afternoon. The lecture for today would be on disaster management. Definitions for disaster is a situation resulting from an environmental phenomenon or armed conflict that produced stress, personal injury, physical damage, and economic disruption of great magnitude. Another definition of disaster would be the occurrence of widespread, severe damage, injury, or loss of life or property with which the community cannot cope and during which the affected society undergoes severe disruption. Both of these definitions note that a disaster disrupts the society stricken by the event. It stresses that the event resulting in a disaster does not comprise the disaster. It is what results from the event that comprise the disaster, not the precipitating event itself. The occurrence of an event may produce a disaster, and a disaster happens when the damage rendered by an event becomes so great that the local mechanisms for response become overwhelmed and outside assistance is required to cope with the damage. Coronavirus can be considered a disaster. More recently, the volcano eruption in the Philippines. And we have been stricken with disasters for the past century that brings about problems and catastrophes in local systems. The definition of a disaster, which is adopted by the WHO and the United Nations, is established by God, is the result of a vast ecological breakdown in the relationships between man and his environment. A serious and sudden disruption on such a scale that the stricken community needs extraordinary efforts to cope with it, often with outside help or international aid. This definition also indicates that it is the damage that results from the impact on society that constitutes the disaster and not the event that is the disaster. Examples of disaster would be a medical disaster or health disaster, such as what we are experiencing now with coronavirus. The most common medical definition of a disaster is an event that results in casualties that overwhelm the healthcare system in which the event occurs. A health disaster encompasses impaired public health and medical care to individual victims, and it relates to the healthcare or break in healthcare to individuals as a result of an event. Broadening its definition, it's a precipitous or gradual decline in the overall health status of a community with which it is unable to cope adequately. Using this definition requires an assessment of the pre-disaster event health status of the affected community. And by definition, the disaster begins when it first recognized as a disaster and is overcome when the health status of the community is restored to its pre-event state. Responding to medical disasters aim to reverse adverse health effects caused by the event, modify the hazard responsible for the event, decrease the vulnerability of the society to future events, and improve disaster preparedness to respond to future events. An event that results in a large number of casualties may or may not constitute a disaster. If local resources are unable to cope with the numbers and/or types of casualties and outside medical help is requested, then the event has created a disaster. Examples of events that may generate mass casualties include transportation accidents, tornadoes, terrorist bombers, avalanches in inhabited areas, etc. And the impact depends upon the ability of the affected society to cope with the circumstances, whether the society remains intact and mechanisms can be developed within the infrastructure to cope with the circumstances. Many consider events that produce multiple or mass casualties as a disaster since the immediately available local resources transiently may be overwhelmed. But if such events are brought under control and the effects on the medical community are short-lived without a need for outside assistance, there is no disaster. What are definitions of hazard? All disasters are related to a specific hazard or combinations of hazards, whether of a natural phenomenon or a result of human actions. A hazard is anything that may pose a danger, thus it is used in this discussion to mean a natural or man-made phenomenon or a mixture of both that has the potential to adversely affect human health, property, activity, and or the environment. Risk, on the other hand, is the objective or subjective probability that something negative will happen. For example, the probability of an earthquake occurring in the northern Europe is quite low compared to such a hazard becoming realized in California or Turkey. Probability of a cyclone becoming realized in India or Central America is huge compared to the probability that such an event will occur in Canada. So risk applies only to one specific hazard. And prevention means to keep the event from happening. And thus prevention is the aggregate of approaches and measures taken to ensure that human actions or natural phenomena do not cause or result in the occurrence of an event related to the identified or unidentified hazard. It does not mean decreasing the amplitude, intensity, scale, and or magnitude of the event. Modification of the event does not mean that the event will not occur. It can change either the nature of the hazard or the risk that the hazard will involve into an event. In terms of the hazard, it is the aggregate of all approaches and measures taken to modify the amplitude, intensity, magnitude, scale, and probability of the equation of the event that would have occurred without human intervention. So through human activities, the resulting event might be augmented or attenuated both in magnitude and frequency. And risk management would involve human actions that are directed towards modification of the probability that an event will become realized. An event occurs when the hazard is realized or becomes manifest. It is an occurrence that has the potential to negatively affect living beings and or their environment. Such occurrences have a characteristic type of onset, intensity, duration, scale, and magnitude. Events may be sudden, gradual, slow, or delayed in onset. Sudden onset events include those with onsets lasting for seconds to hours. For example, earthquakes, tsunamis, cyclones, etc. Gradual onset events have an onset over days to weeks, examples of which are floods, climate change, epidemics, armed conflict, and may or may not present with warning of several days to weeks. Slow events have a prolonged and gradual onset, such as famines, droughts, epidemics, and natural contamination. Delayed onset events occur sometime after the discovery of the likelihood that the hazard will become realized. Such events usually allow forewarnings to the population that potentially will be impacted by the environment. Duration may be brief, short, intermediate, or prolonged. Brief duration lasts only seconds to minutes and therefore necessarily must correlate with a sudden mode of onset. Events of short duration continue in some form for hours to days. Examples include cyclones and floods. Intermediate duration may include epidemics, toxic or nuclear contamination, fires, and intermediate duration may event last for days to weeks. And prolonged periods include drought, famine, epidemics, and complex emergencies, and nuclear contamination. The scope of event includes its amplitude, intensity, scale, and magnitude. The amplitude is the degree of departure from the point of equilibrium. Examples of amplitude include a flood crest, a storm surge, and wave height. Intensity consists of the amplitudes integrated over a given period of time. Examples of intensity include the amount of rain falling in an hour and the quantity of ash falling in a specific location per hour. The scale of an event is the intensity of the event in the geographical area involved. Examples include the incidence of a specific infectious disease in a country, the depth of rain that accumulated in a specific city in a given period of time, and the number of hectares under an accumulation of water due to flooding. Magnitude is the total energy encompassed by the event, the combination of the integral and of the amplitudes, the area involved, and total duration of the event. Examples include the kiloton explosive equivalent of a nuclear bomb and the total rainfall accumulated over an area during the entire course of a storm. So it could be precipitating or secondary. Precipitating are those responsible for initiating the damage, and secondary is a result of the impact of the precipitating event. Human actions may result in an increase in the magnitude of the damage and/or may be the middle for the development of secondary events. Impact is designed as the actual process of contact between an event and a society or a society's immediate perimeter. Impact refers to both positive and negative influences produced by the event on the environment. Mitigation. In this context, any process that is undertaken to reduce the immediate damage otherwise being caused by a destructive force on the society is called mitigation. Preparedness, on the other hand, is the aggregate of all measures and policies taken by humans before the event occurs that reduces the damage that otherwise would have been caused by the event. It is comprised of the ability to mitigate the immediate result of the impact of an event and our ability to alleviate suffering and accelerate recovery. Preparedness includes warning systems, evacuation, relocation of dwellings, storage of food, water, and supplies, temporary shelter, and energy response disaster drills. Contingency plans and responses are included in preparedness as used in this document and are part of overall disaster management. It consists of actions taken before an event occurs. Damage is defined as harm or injury impairing the value or usefulness of something or the health or normal function of persons. It's the negative result of the impact of an event on society and environment. Damage may manifest in multiple ways and forms. Events may produce damage that may or may not be of sufficient magnitude to result in a disaster. It is the amount and characteristics of the damage that result from an event, tempered by the place of occurrence, society and culture, level of development, degree of preparedness that determine whether an event results in a disaster. Damage may involve humans, other creatures, the environment, and the severity of the damage is a function of the magnitude of the event buffered by the resilience of the society and the environment impacted. Vulnerability and resilience. Vulnerability means the susceptibility of the population and environment to the type of the event. The resilience of the population against the event is its pliability, flexibility, or elasticity to absorb the event. Resilience has two components. It's provided by nature or through the actions of humans. It is comprised of the absorbing capacity, buffering capacity, and response to the event and recovery from the damage sustained. So how do we manage disasters? It's the aggregate of all measures taken to reduce the likelihood of damage that will occur related to a hazard and to minimize the damage once an event is occurring or has occurred and to direct recovery from the damage. The effectiveness of disaster management determines the final result of the impact of the event on the environment and society impacted. And disaster response is the aggregate of all measures taken to cope with the damage sustained. The effectiveness of disaster response is part of disaster management that determines the final result of the impact of the event on the environment and society impacted. Recovery occurs when all of the damage from an event has been repaired or replaced. In the context of a disaster, recovery means bringing all of the societal components back to their pre-event status. All of the responses to the damage sustained must have goals that contribute to the recovery of the society affected. So what are our roles during these extraordinary circumstances? So local organizations must foster a spirit of collaboration in the response to a disaster. It's also the responsibility of each agency involved in the emergency to recognize that the primary purpose of coordination is to achieve maximum impact with the given resources and to work with one another to reach this endpoint. So what are the consequences of disasters on health services? Disasters can cause serious damage to health facilities, water supplies and sewage systems. Structural damage to facilities pose a risk for both healthcare workers and patients. It could limit road access, making it at least difficult for disaster victims to reach healthcare centers, and disrupts communication systems, lead to a poor understanding of the various receiving facilities, military, and relief organizations, and actual capacity. Consequently, the already limited resources are not effectively utilized to meet the demands. So this is what happening to coronavirus. That is why we need to flatten the curve. We do not want our health system to be very much overwhelmed with the increase in the number of cases that needs a ventilator or a respirator or a hospital room. So increased demands for medical attention is one problem. Climatic exposure because of rain or cold weather puts a particular strain on the health system, hence your seasonal illnesses. Inadequate food and nutrition exposes population to malnutrition, particularly the vulnerable groups. Mass casualty incidents, health systems can be quickly overwhelmed and left unable to cope with the excessive demands. There's population displacement. What will happen? A mass exodus from the emergency site places additional stress and demands on the host country, its population, facilities, and health services. Depending on the size of the population migration, the host facilities may not be able to cope with the new burden, and mass migration can introduce new burden to the host community. Major outbreaks of communicable disease. While natural disasters do not always lead to massive infectious disease outbreaks, they do increase the risk of disease transmission. The disruption of sanitation services and the failure to restore public health programs, combined with the population density and displacement, all culminate in an increased risk for disease outbreaks. And these endemic vector-borne diseases may increase due to poor sanitation and the disruption of vector control activities. Our role of emergency health services or frontliners in disasters is to minimize mortality and morbidity, and it's necessary to organize relief response according to three levels of preventive health measures. Again, you meet your primary, secondary, and tertiary. You very well know the meaning of these levels of prevention. What is the role of military in disaster response? The military's hierarchical command structure allows it to respond to disasters in a rapid and coordinated manner. Military services generally have easy access to resources and are equipped to perform vital functions. So you will see it is not a debate between military versus medicine as the solution for coronavirus. It should work hand in hand. If the political climate allows for collaboration or hand in hand, the host country's Ministry of Health and lead health agency should coordinate with the military in the response to a disaster as well as making a disaster preparedness plan. The health objectives of a disaster preparedness plan are to prevent morbidity and mortality, provide care for casualties, manage environmental conditions, ensure restoration of normal health, re-establish health services, protect the staff, and protect public health and medical assets. Policy should be made by the national government with the responsibility to develop and organize and manage an emergency preparedness program for the country. They must work with central government, provincial, and community organizations and NGOs. Hazards for the community are identified and prioritized in a vulnerability assessment. Once the vulnerabilities are identified, the assessment must also recommend how to address each of the vulnerabilities, such as in the coronavirus, the underprivileged are the ones who are getting aid first. Of course, they would be the one that no work, no pay, policies would be affecting their jobs, or they could have been laid off. So they are the first ones identified who need help during this pandemic. In disaster planning, a disaster's output plan must provide an understanding of organizational responsibilities in response and recovery, stronger emergency management networks, improve awareness and participation, an effective response and recovery strategies, and a simple and flexible written plan. We must provide the important skills and knowledge needed to show an affected community how it can participate in emergency management, and also show if the appropriate and critical actions needed in an emergency. Then we have to monitor and evaluate to measure how well the disaster preparedness program has been developed and is being implemented. So there are different societies such as the Red Cross, which created preparedness and press the button response systems with equipment ready for immediate use. So between disasters, it pays a lot of attention to training volunteers in the community. So facility-based healthcare. So all services should function effectively and be well coordinated to achieve the following: comprehensive care, continuity of care, and integrated care. Mass casualty incident is any event where the needs of a large number of victims disrupt the normal capabilities of the local health service. So this would require the pre-establishment of basic guidelines and principles of an incident command system, triage, and patient flows according to the hospital's plan. We have heard of news that heart patients and stroke patients get delayed treatment because of the fear of seeking consult during coronavirus pandemic. The incident command system is composed of 5 major components. It's the incident command, operations, planning, logistics, and finance. Triage. In a disaster medical response, triaging sorts and prioritizes victims for medical attention according to degree of injury or illness and expectations for survival. Triage reduces the burden on health facilities. And it's based on the following criteria: the nature and life-threatening surgery, and potential for survival. So we have the classification system. So there's immediate medical care, there's delayed care, non-urgent or minor, and dead or near dead. So whenever there is a scene where there are lots of bodies, you do triage. If it's dead, like it or not, we leave them behind. Because what if we could see someone who is just intermediately or a little bit damaged, but would have Hierarchical response. Fairness. This value requires that healthcare resources be allocated fairly, with a special concern that those most vulnerable are treated fairly. So remember your bioethics lessons as well. Respect for person. So informed consent still. Solidarity. Commitment not only to family but also the community. And limit harm. So each physician and healthcare professional commits to do no harm. And how do we respond? It's according to reasonableness. Treatment decisions are based on evidence, transparency. It's open to public discussion and scrutiny, inclusiveness, responsiveness, and responsibility. Clear? So this is by UN Secretary General Kofi Annan. So it is my inspiration that health will finally be seen not as a blessing to be wished for, but as a human right to be fought for. Of course, we have to establish linkages between health and human rights so that it would not be violated and have serious health consequences. Vulnerability impacts ill health can be reduced by taking steps to protect, and fulfill human rights. So remember our health declarations. We have the right to health. And it does not mean the right to be healthy, nor does it mean that poor governments must put in place expensive health services. What it tells you is that we need policies and actions plans which will lead to available and accessible health care for all in the shortest possible time. And it's also a right not only to health, but the highest attainable standard of health. So this is in with the UN Constitution, our basic happiness, harmonious relations, and security of all people. So our criteria to evaluate right of health, remember availability, accessibility, acceptability, and quality. And remember your bioethics, justice as a right, so that we could give communities a moral basis from which to claim international assistance if needed. So this, in summary, is the rights-based approach to health. So substantive elements to apply within this process could be as follows. So safeguarding human dignity, pay attention to the vulnerable groups, ensure health systems, use a gender perspective, equality and freedom, disaggregate health data, and ensure free, meaningful, and effective participation of beneficiaries of health development and policy. So, important is transparency and accountability that would safeguard to protect against majority threats of minorities to the health system. A key factor in determining if the necessary protections exist is that each one of the 5 criteria of the Syracuse Principle must be met. Okay? So an adequate level of healthcare can lead rapidly to situations falling within the scope of the team, as inhuman and degrading treatment. We hear news about this kind of treatment left and right regarding medical personnel and rights. So, for medical personnel, no one shall be subjected to torture or cruel, inhumane, or degrading treatment or punishment. Remember last year, there was an issue in India wherein doctors were attacked in a private hospital. And also, the Declaration of Tokyo states that the physician shall not countenance, condone, or participate in the practice of torture or other cruel, inhuman, or degrading procedures, whatever the offense of which the victim of such procedure is suspected of. And in all situations, it is not allowed armed conflict in civil. Under military, an extreme case in recent history occurred in Nazi death camps, U.S. soldiers in Vietnam, the terrorist attacks in September 11, or for us at home, it's the terrorist attack in the hostage hotels. So military medical personnel are placed in a position of a dual loyalty conflict. So who would you serve, the hospital or the army, health, or for safety? And these dual obligations are the following. Primary duty is still to the patient and secondary to employer. Clinical independence is essential for both therapeutic care and forensic documentation. It may result in criminal prosecution, and forensic clinicians have a duty to the court and must inform individuals of their role and any limits of confidentiality. Again, ethical precepts that legal and other imperatives cannot oblige health professionals to act contrary to medical ethics. For human experimentation, it's adopted in 1976. It states that no one shall be subjected without his free consent to medical or scientific experimentation. Declaration on the Human Rights of Individuals, according to 1985 General Assembly, no alien shall be subjected without his or her free consent to medical or scientific experimentation. Again, we also go back to poverty. It's a general scarcity or dearth, or the state who lacks a certain amount of material possessions or money. Destitution or absolute poverty refers to deprivation of basic human needs, which include food, water, clothing, shelter, education. Relative poverty is defined contextually as economic inequality in the location or society in which people live. So this is the percentage of people living in absolute and relative poverty. So you see there are millions of people in China, in Africa, etc. and remain as a global challenge. Such that you cannot stop people from migrating. It's the movement by people from one place to another with the intention of settling temporarily or permanently in the new location. It's typically over long distance and from one country to another. Internal migration is also possible. For example, you students from India went here to study medicine in the Philippines. So it's either voluntary or forced or involuntary migrations, which may include slave trade, human trafficking, and ethnic cleansing. So the World Bank estimates total number of immigrants would be 215 million. So, about 3.2% of the world population, either voluntary or involuntary. And human trafficking is the trade in humans most commonly for the purpose of sex, labor, and exploitation, or extraction of organs or tissues, including surrogacy and ovary removal. So it can only occur within a country or transnationally. Human trafficking is a crime against the person because of the violation of the victim's rights of movement through coercion and because of their commercial exploitation. Trade of people and does not necessarily involve the involvement of the person from one place to another. It's a 31.6 billion trade industry per year, and human trafficking is thought to be one of the fastest growing activities of transnational criminal organizations. And we condemn it as a violation of human rights. Slave trade and human trafficking are forbidden and adopted by the UN since 2000.